Hello, everyone. Welcome. Welcome. It's 10 o'clock. We will give everyone a minute to come on and get settled before we begin. Happy Tuesday, everyone. If to get to see who's here, please add in the chat your name and what organization you're joining us from today. I'd love to see who all is here. All right, a couple more people are trickling in. Good afternoon, everyone. I think I might have said good morning. I'm in Arizona. It's 10 a.m., so I'm a little confused as to what time of day it is. So thanks for bearing with me today. Thanks for adding your name and program into the chat. My name is Heather Sharmoli, and I am the Professional Development Systems Coordinator at Childcare of Minnesota. And you are joining us for the March 2025 TEL Talks. So thanks, folks, for adding information to the chat to see who all is here and to be able to connect with each other. I am going to go ahead and get started. Our TEL Talks are monthly webinars based on identified interest areas to facilitate solutions-focused discussions for questions about the early childhood field in Minnesota. So beyond today, we have our April and May schedule coming up. Kelly Kazak is going to join us from DCYF to talk about some resources around outdoor and nature-based learning in April. And in May, some friends from the Center for Inclusive Childcare will be here to discuss some of their programming opportunities as well. And I didn't even get a chance to type this in because it's just a something that I was able to confirm this morning. In June, we will have a legislative briefing as so that we can identify what changes were made this legislative session and what does that mean for us as providers. So I'm excited to welcome Kara Lebke from Childcare Aware of Minnesota to share that with us. And hopefully we'll have lots of great information to share at that meeting. One more slide. Childcare Aware of Minnesota helps families find quality care and programs and meet their daily needs. We work with 5 districts across the state, along with Eager to Learn and MNTREC, Minnesota's Tribal Resources for Early Care. And we coordinate professional development through online learning as well as in-person opportunities, grants, QRAS, the Parent Aware System, scholarships for TEACH and CDA, the RETAIN grants, as well as the Empower to Educate program. And we also offer trainer and RBPD support through our offices. We want to keep the community informed on what is happening in the field. So if there's topics that you see or hear about that you think would be really great for a webinar, please be sure to let me know. TEL Talks are typically brought to you by myself, Heather Sharmoli, and Michelle Yang, but today she is on vacation, so I'm flying solo. But I am here today with a very good friend of mine, and I'm excited to have her share about her organization. So please join me in welcoming Jamie Bonza to our webinar today.
Hi, everybody. Thank you for having me. I really look forward to sharing a little bit about the work that I find very exciting that I get to do in my day job now. Just for those of you who I have not met, I come to the field of early childhood as a former preschool teacher, center director, executive director. I've worked in Head Start for, it used to be half my career, but I keep getting older. So I don't know what the percentage is, but in an administrative position, I worked in Head Starts here and in Chicago for over 10 years. And then have been working at Greater Twin Cities United Way for the last 3 years on an initiative that I'm here to talk to you about, 80 by 3 Resilient from the Start. When it comes down to early childhood leadership, I feel like I have done everything besides have to replace a toilet by myself or drive the bus. Both of those things you don't want me responsible for. Everything else, I feel like I have gained a lot of lived experience in coming up closer to 3 decades. I used to laugh when people would say how long they'd been doing the work, and then they thought about it and said how long. And I was like, well, that doesn't seem like that long until you do it. And then it starts to feel like that. So Heather, if you could go to the next slide, I'm just going to explain a little bit about Greater Twin Cities United Way and our role in the community. So we serve the 9-county metro of Greater Twin of Minneapolis and St. Paul, and really looking to support changes towards a community where all people can thrive regardless of race, income, or place. The work I lead comes from under our education supports, is early childhood education, but we really are also looking at things like housing stability, food stability, so that individuals can have quality of life over time. And our mission is to unite change makers, advocate for social good, and develop solutions to address the challenges that no one can solve alone. And that is really the work that 80 by 3 looks at doing, is de-siloing some really amazing work that's happening in the community and bringing people together in coalition. And we're going to get to that in just one second. I'm going to tell you how we do it, and then I'll tell you what we're doing. So if Heather, you'll go to the next slide. So I get the opportunity to work in our innovation department. Right now, I lead one of 4 innovations. The innovation I lead is 80 by 3, Resilient from the Start in childcare. We also have a Full Lives innovation that is working to look at food justice and food insecurity. We have Pathways Home, which is at the intersection of those who are exiting the foster care system and incarceration. And our largest running innovation is something called Career Academies. So that is really working on wealth building opportunities in a pathway from high school to college for individuals who have not maybe had that opportunity in the past. We all on the innovation team do this in kind of following these 3 circles. However, it is not linear. So we listen to community, we co-create or test, and then we amplify. And essentially we start again and again and again. So I will just get an opportunity to tell you a little bit about what that has looked like over the last 3.5 years, and essentially bring to you some of what we've heard from community, some content that we've been able to co-create with community that's going to be at no cost to you. And then here in a TEL Talks, amplify the good work that's been happening that you can take advantage of. So Heather, if you go to the next slide, I will tell everybody what we've learned. So 80 by 3, I love to get ahead of myself, but I keep this slide in here to tell you what it is and what does it mean. So we are going with the thought process that 80% of brain growth happens by the time a child is 3, and really thinking about those neural synapses and the things that we have learned about science and how very critical these first early lives or these first early years are in a person's life. And ultimately what we're trying to influence is that to have a trauma-informed system change initiative aimed at transforming the early childhood landscape. So our hope is that all children that are in childcare would have access to trauma-informed care. The work that we're doing is time-bound, so we are not here in perpetuity. We are here to accelerate changes that are already happening in the state of Minnesota, and I'm going to go ahead and start with some of those. So Heather, if you would go to the next slide. I want to start with the why. Why are we doing this work and why are we doing this now? So this data comes from the Center for American Progress that states that 7.6 of Minnesota children under 6 have 2 or more adverse childhood experiences. So we're going to get into the definition of what are those adverse childhood experiences, but thinking about that from the context of children, that's 7.6. What I can tell you from the perspective of the Center for not Center for Inclusive Childcare, the Center for Disease Control, is that 1 in 6 adults, not just in Minnesota, but in the United States, have 4 or more adverse childhood experiences. And so when we're thinking about why do we need to have a level of sensitivity, why do we need to understand what happened to people and not necessarily think like what's wrong with people, why are we switching that narrative, why are we moving from this place where we're really thinking about the environments that children are being supported through many hours of their day and our staff are working in many hours of the day, is that we want healing centered engagement or healing centered environments so people can move from surviving to thriving. So Heather, if you will go to the next slide. I'm going to use the definitions of trauma and just make sure that we're all using the same language as I talk today. The source for this is the Minnesota's Knowledge Competency Framework. If you don't read that document as often as I do, it's on page 64 is where this starts. And these updates were made in 2020. But if you remember, 2020 in Minnesota was kind of the intersection of those twindemics of the COVID-19 pandemic and the social uprisings happening in really everywhere, but primarily in Minneapolis and St. Paul. And so some of the way that this document may have been socialized to recognize these updates may have been impacted by those events, and the relevance to like, why are we talking about this now is equally as critical for what we have seen as a result of those and the way that those are showing up in adult and children's behaviors in our context. So the definitions here are events that are perceived as threatening the life, physical integrity of the child or someone important to the child, and what is perceived as a threat changes the child's developmental stage. So we're talking about developmental potentially delays, or we're talking about disruptions, something that causes an overwhelming sense of horror, helplessness, or terror, producing intense physical effects such as pounding heart, rapid breathing, trembling, and completely overwhelming the child's available coping strategies. And the younger the child, the fewer coping strategies they have. So just remembering that from a developmental perspective. When we talk about what are some examples, we are talking about abuse, neglect, witnessing violence, separation from an important caregiver, painful medical procedures, accidents, deep poverty, refugee experiences, and race-based trauma. Some of these, but not all of these, align with the updates to the early learning scholarship priority areas. So, and what we know about the last data that I saw from that was that 64% of our children that were on early learning scholarships were identified to be in a priority area. So just a little context of what are we talking about? Why are we talking about it now? And how does this align to what people are really experiencing in Minnesota and what early childhood educators and leaders can do to help? So Heather, if we can go to our next slide. You cannot read this. There's no way that you'll be able to read all of this. This is an image that comes from Child Trends. You can easily Google this image, but I just want to think about like, why are we talking about this and why do we want to make sure our educators and our leaders have some knowledge of what trauma is and some skills to impact their environments to lead in a way that is trauma informed, is that childhood trauma can impact children's emotions, their relationships, their mental health, their behavior, brain development, cognition, and physical health. What we also know over the course of a lifetime is that adults who had trauma in early childhood who never processed those things also continue to have those impacts. And so when we are talking about, we being Greater Twin Cities United Way, when we think about trauma-informed or trauma-sensitive care, we really are thinking about this from the context of a 2-generation approach, and not just children and families, but children, families, and those who work with them, knowing that many of the educators and leaders who are doing this deeply important work have never had the opportunity to maybe process some of their own experiences. And as they are going through learning about trauma and trauma-informed care for children, it can be activating for some of those responses. So we will talk a little bit about what we've learned here in a second. So Heather, if you can go to the next slide. Just to say, what is trauma-informed care? And this comes from the Substance Abuse and Mental Health Service Association. It is that a program or an organization or a system, so this could be where you are working or all of us together, but if we are working towards a trauma-informed system, it is a system that would realize that the widespread impact of trauma and understands the multiple paths for recovery. It would recognize the signs and symptoms of trauma in clients, families, staff, and others involved in the system. It would respond by fully integrating knowledge about trauma into policies, procedures, and practices. And it would seek to actively resist re-traumatization. So in the design of 80x3, we really do work towards all of these pieces and try to provide resources that align with both bringing to mind the awareness of like how frequently and pervasive early childhood trauma is and how that can live within our organizations, both in our children and our adults. So Heather, if you can go to the next slide. So we have created some content and some resources that I'm going to talk about in a second, but everything that we have done over the course of the last 3.5 years has really been to align with that knowledge competency framework document, that trauma-informed care and practice piece of the knowledge, page 64, and really supporting the early childhood workforce, because it's critical that we understand some of these things. What I also know is that everybody has so much going on. They don't have time to do anything more than. So in collaboration with those who are responsible for Parent Aware, we advocated for the alignment of the knowledge competency framework and the early learning scholarship priority areas to come to a similar time frame. And so both of those were updated July 1 of 2024. So if you or your organization, those that you coach, those that you train, are taking trauma-informed care content that aligns with the knowledge competency framework now, you will get credit in that Parent Aware. I believe it's section 3 that aligns with social and emotional education. So those now, they can count both towards Parent Aware. So just thinking about supporting the early childhood workforce, both, I would say, with the information so that we can all have a shared vocabulary, but also in reducing expectations and or like making sure that everybody can get that information in a way that they can also get credit for it. So we're really aligning to supporting the workforce in that way, knowing that the information is important. The way of knowing and being is important. And also we only have so much time. So that's one way to think about supporting the workforce. And then Heather, if you'll go to the next slide. This is just an example, if you have not looked through that section, of some of the things that they're both ambitious and important. So I think that this is one of those things where two things can be true at the same time, is how do we make sure our educators, our leaders in the classroom, our leaders in the in programs, our family child care providers, and also all of the people who are working in the training and technical assistance realm get the opportunity to know all of this content. And when I think about how this shows up in each one of us and the way that we can work together collaboratively, the first thing I think we need to know is how to look at this information and make sure that there's professional development, but not just to look at, but to process together. So I'm going to tell you a little bit about how we can do that. Before that, I just said a lot of words. So while we have this slide here, if there's any questions, you can put them in the chat and I'll just pause to answer some of those while we look at the individuals that have supported 80x3 in knowing and responding to the needs of our community.
I don't see anything coming through on the chat, but feel free to add things in as we keep going.
So before we keep blasting through, because I'm saying a lot at you, I would just invite everybody to like maybe put their feet on the floor, take a couple of deep breaths, because this is a lot of information, and as well equipped as I'm sure everybody is here, it's this work around trauma informed care can be very dysregulating to our nervous system. So just put your feet on the floor, maybe put your hands on your knees and take just 2 or 3 deep breaths to ground yourself in here. All right, Heather. I think now we're getting to the exciting part, which is the what are some of the resources that are now accessible or available to individuals in the field? So if you'll go to the next slide, now that we've seen who helped make all of this possible, I wanted to say a little bit about what we've heard from leaders. So these quotes come from center directors. We have also worked in collaboration with the many training and technical assistance organizations that you likely have seen on the previous slide, but that the coming together in 80x3 has been a good source of language and the concepts of trauma, and that organizations are feeling more confident in recognizing and creating strategies to support not only children, families, but staff. So that has been an outcome of this work and doing this work together, is that those who are in leadership positions feel better equipped to support the people in their care. One of the leaders said that they had a better understanding of how to support their team and what resources are available for families in their program. They have better connection with families and staff who have experienced trauma. And then one other quote here is that the trainings have given insight on how trauma affects individuals. And this has been helpful in training teachers in the classroom management techniques and how to interact with classroom children who may need extra supports. So what we have really, all of these say is by going through shared professional development together, whether those were leaders going through that together, trainers going through that together, coaches going through that together, educators, is that we are creating more awareness. We are giving language to, we are changing some perspectives of like, what is it that we're experiencing collectively? And some of those pieces that we also know is that we have better techniques on what do we do when we see an individual who has some disruption? And that really could be at any of those levels. It could be a parent, it could be a child, it could be a staff member that has some disrupted development because of what they're going through, and they need some support, and figuring out how do we offer those supports in a way that's sustainable for the program. All right, Heather, let's go to what are those supports? So some of the things that 80x3 has co-created and now has out in the community is we've been able to expand the reach of neuroscience. So neuroscience is neurobiology, epigenetics, ACEs, and resiliency science. We currently have nearly 30 individuals going through a Train the Presenter with that content, and are able to bring develop approved credits to the community through our partnership with an organization called FamilyWise. Heather, one thing that I did not put out here is that FamilyWise has a statewide virtual convening on May 20th. So if you save the date, I can try to get information out to all of you on the call through Heather. It's going to be a really exciting opportunity because it's the first time, this is the 8th annual event that they've done this. And it's the first time they're focusing on early childhood for 2 reasons. One reason is that they have been a collaborative partner of 80x3 for nearly 3 years. The other part is that the Surgeon General has a report that says parents are very stressed out and that we all need to do something to support our youngest children so that they don't have grow up in environments of toxic stress. So there's a little bit on neuroscience. We have a website. So Heather, if you'll drop that in the chat, that would be super helpful to make sure that Everybody has access to resources. All of this is at no cost to you. So if there's resources or implementation guides that you can use, the picture on our slide that you're looking at is in the educator and administrator tab. So you have a pretty quick reference here to many of the things. If you will pop into the chat, 2 things that are on those quick links. One is content from the Center for Inclusive Childcare. We co-created content with them and worked with the Ellingson Center out of St. Cloud. And then we also worked with Think Small Institute to create content. The content on Center for Inclusive Childcare, if you go to that tab that Heather dropped, what has been incredibly successful is for staff members to look at those self-studies, which are typically you would do them by yourself, but individuals are taking that and going and having their whole staff sign up for the Develop Approved credit and going through them together. And then at the end, the staff members also have to submit their individual 500-word essay if you are familiar with CIC self-studies. But it has been so successful that it has moved from typically those are about 100 people a year, according to talking to Priscilla Weigel, about 100 people a year do a self-study at CICC. Over 600 people have done this content. I'm sorry, my dogs just burst in. So if you hear this gremlin sound in the background, that's what's happening. It's not me. And then if that content from Think Small that we have created on our website, if you go to the very bottom of the webpage, there's a little tab that says funding. And if you would like access from those leadership modules of training that we have done, and some staff have gone through those together as well and had a discussion on them, you can get a code if you email my team, and we'll send that to you so you can get access to those at no cost. And all right, so those are just like a couple of things that I feel really confident about. I could tell you all about how we did things for 3.5 years. You don't want to listen to all of it, but we have done so many cool things in partnership with our collaborative partners. And we couldn't do any of this work without the people who are directly working with children, families, and in staff, in organizations, whether that's working with coaches, trainers, or those who are directly providing service. We wouldn't be able to do anything without that co-creation model. So if we can go to the next slide, what I'd love to be able to tell people about is for organizations that are nonprofit organizations in the 9-county metro, we currently have a funding opportunity that's available. So on the previous slide where we showed those like 18 funded partners who've collaborated, we have many more partners that are non-funded partners that use some of this content, that create opportunities for shared staff development on their own professional development days without training and technical assistance or grant supported funds from Greater Twin Cities United Way. So please know that everything I've shared, we would love for you to use it. I'll also just give you like a sneak peek that CICC is going to be working to have a new module come out June 1st. So all of that. And the funded partners that were listed on that previous slide have been able to be supported in a cohort with training and technical assistance from local and national training partners and received grants. So currently we have an opportunity for 9 nonprofits that serve the 9-county metro to apply to receive support. That support looks like an 18-month cohort that gives organizations grants of $65,000 a piece. And they receive a comprehensive training and technical assistance package valued at $25,000 over the course of 18 months. It is, I'm not going to pretend like it's not a lot of work. Heather, in a previous life, did go through one of the cohorts. It does require about 2 to 4 hours a week for the duration of the grant period to really understand how to do systems change, but you don't do it alone. And so the grant funding takes away some of the financial burden of participating, but really it's the training and technical assistance package that happens and brings people together through a cohort that allows individuals and organizations to look at their own leadership practices, organizational practices, in what conditions need to be true for really offering that trauma-informed and through a culturally responsive lens. So Heather, if you can go to the next slide, what does this package even really look like? So each individual who goes through the cohort gets a strengths-based assessment to look at their own leaderships, like what are the strengths that they bring to any kind of team, any kind of change management. There's peer-to-peer mentorship that happens. There's both in-person and virtual retreats that are part of this. There are community of practice sessions that help pull individuals together. And for the organizations that participate, they also get an organizational equity audit to look at how do the individuals who are participating in or that those organizations, what does it look like, feel like, sound like to work in an organization that prioritizes belonging in a way that really allows people to show up as their true self and be in that healing centered approach to the way that we do childcare in Minnesota. There's goal setting support. We also have a organization called Creative Caponia that works with has worked with many of our funded partners in offering a healing circle on things like how do we handle burnout? What are the or it could be on like historical trauma. Like what do we need to understand about that and share together on site? So those healing circles are for up to 30 people. And then that staff development that I mentioned, everybody has access to everything that I shared, but some of the opportunity when we find like what really works well for people to take advantage of the staff development is for people to have support and essentially like a checklist to say like, yep, we're going to do this. We've got the support to do this. We've got some reminders to do it. We have a cohort of other individuals going through this at the same time. So we can say, hey, what happened when your staff did that? Because my staff got kind of activated and we're looking at additional supports that may be necessary. So those are some of the grant activities. And then if we can go to the next slide that has, if people are interested, I'm happy to, I also have office hours where I could just like sit down with somebody who wants to know this, but 3 individuals from each organization would participate for 18 months. And so we would want those individuals to be leaders that have the capacity to look at organizational practices, policy changes, budgets, that kind of like responsibility to the organization and to the people who work there to make changes when changes are needed. And then if we can go to the next slide, it should have our timeline. So the RFP is open now. It closes March 28th and notifications, well, that's okay. Notifications will happen mid-April. There is a round of interviews that happen, but ultimately that next cohort will happen June 26th of 2025. So I said a lot of things about kind of what we're doing, how we're doing it, but this is the time that we have to really answer any questions, point out direct supports, and tell you anything else. If you don't live in the metro area, there's so much information on the website that I'd love to be able to point you to the resource you actually need to be able to take this information back to your organization.
Jamie, are you okay if I put your email address in the chat?
Yes.
Okay, I've also linked the funding opportunity application there. So do you see the question in the chat, Jamie?
Yeah, so Elizabeth, the equity audit happens through our national nonprofit partner called Embracing Equity. They do have a national cohort that has not started yet. It is, I mean, this is at a cost to organizations, and that is beyond the scope of what I know about, but I know that there is at least one Minnesota organization that is opting in to the national cohort, and they will be able to get that equity audit. They'll be able to get the results. They'll be able to get coaching as part of that. And so Heather, if you will drop the Embracing Equity link in the chat, that would be really helpful, because anybody in Minnesota could participate if their organization had funds. We just are able to make that training and technical assistance at no cost to the 9 nonprofits that both apply and get selected for this next cohort.
While we're looking for other questions in the chat, I just want to say I have been involved in this work as a funded partner, as well as I've been fortunate enough to be on the advisory group for this work as well. And I'm just so proud of everything that has been accomplished over the last few years. To say that I'm a part of this change in hearing how it's really impacting programs at the level of children and families is just incredible. And so I really encourage anybody who's thinking about participating to step up and take a chance to sign up, because it's definitely worth doing it, right? So things in life that are worth doing aren't always easy, but they're definitely, this one for sure is something worth doing.
You know, seeing Elizabeth's name just as it reminds me that over the last cohort, we did have a team of 3 individuals from the state of Minnesota that walked alongside of us so that these gains that we're making can be sustainable and built into strategies over time. We will also, in this next cohort, have a team of 3. They have already been identified within the state of Minnesota, but to continue to bring this work forward, because the change, any kind of change management, it takes time. And so if we really think about like how long does it take to make the kind of changes that we're talking about, it really does take time, talent, and treasure to make the kind of changes that we're talking about in early childhood programs, but not just those that provide direct service care, but also in the organizations that provide training and technical assistance, because this work is for all of us. Like, we all need and deserve to have work environments that are responsive and also like help us create some level of understanding about what is happening with the people within the field. So I think that some of the greatest learning has really been that all of this content has allowed people to talk through, depending on the level of support. Like, there have been some conversations that have been supported with people who were mental health practitioners. Some of our friends over at Early Childhood Mental Health Consultation have offered some reflective supervision and or directors groups. We've also worked with MACMA, the Minnesota Association of Children's Mental Health, so individuals can process some of this, because it is quite it can be quite draining to only like learn about the information around how prevalent trauma is in our communities without any support in order to process that. So what I would say is, what's predictable is preventable. So when we learn more, we are better able to be prepared for environments. That comes from our friends over at FamilyWise and their near science content. And something else that comes from our friends over at Embracing Equity is, when we're doing this work and we want to do it well, is we need to move from being well-intentioned to well-equipped. And so some of these opportunities and thinking through how do we work to get this information out to all corners of our state. I just had the opportunity to go up and have a beautiful conversation with some directors in Northwest Minnesota. I went to Bemidji last week. I don't get to go everywhere, but I did get to partner with the Child Care Aware Association serving that area. And we had some really amazing conversations about what does it look like, feel like, sound like when we are able to offer, you know, the more restorative practices in our spaces, and what do we all kind of need to know in order to do that work together. So I do encourage you to take those asynchronous modules and work together. There's also content that's not listed in the chat, but we could get it to you in a email afterwards, from the Minnesota Association of Children's Mental Health. Those they have facilitator guides where you can bring, they have 8 hours of developer approved content themselves to help bring more awareness. And I would just encourage anybody, as they're thinking about partnering this work, of having additional spaces to like move through the body, breathe, have maybe a mental health practitioner that could like help debrief with some people if you can work with early childhood mental health consultation in your area. Any other questions that might be coming up?
Don't see anything else in the chat. Tristan wanted to thank you for sharing the training opportunities. It's great for her to be able to share. She's a training plan staff for West Central District.
I'm just going to grab those training modules for you from MACMA so that we all just have them right now. Drop them in the chat. And then I have the time to stay on and answer one-on-one questions that individuals may have. I know that the number one thing that nobody ever has enough of is time. And so if there's one thing that if you had this booked out in your calendar till 1 o'clock, but what you're like, wow, that was a lot. I encourage you to, wherever you are, either go outside, because I know it's almost 40 most places, and or just like close the door to wherever you are and lay on the floor and just breathe for a few minutes and take care of yourself.
Right. Thank you so much, Jamie, for taking time to share information about this incredible opportunity and all of the work that you are doing at the Greater Twin Cities United Way. I appreciate you as a friend, as a colleague, and as just an incredible professional in the work that you're doing.
Well, I appreciate you because it's not always easy. And the thing is that we never want to do this kind of work alone. So make sure you have your colleagues, your friend colleagues that you can call in doing this work. And please just help us with amplifying these resources, because at this time they're at no cost to individuals. And so we really want to make sure that as many people as possible can benefit from the resources. And just know that that content from Center for Inclusive Childcare, they did work with 2 mental health practitioners from the Ellingson Center in St. Cloud, and they really have some practical application strategies. They also in their videos have an amazing video from an occupational therapist named Alyssa Mason, who helps us kind of understand like what are some practical strategies. As a parent, I was like, oh, these are really good reminders. So remember that this is also work for ourselves.
Great. Thank you, everyone. And I appreciate everyone's time. Enjoy the rest of your afternoon. And please reach out if there's any questions, or if you have any need any questions for links, or you can't remember Jamie's email address. I'm happy to help make those connections for you. So I am going to stop sharing and hang out a few more minutes as everybody is kind of heading out. If there's any other specific questions, I can't end the recording without ending the event, I understand. So I don't want to cut that off. So I'll just wait a couple more minutes as people are leaving. Thanks so much for your time today and spending your lunch break with us. Okay. I'm going to hit the end event button and see if you disappear. If that's the case, I will talk with you soon. If not, we can debrief a quick minute.